some of you all must be confused, the surname out here and the surname that he said. The surname Jain was prior to my marriage and now I'm like Bakshi. Okay, how much information do you all have about diabetes and diet in diabetes in specific? Can I have some input from your side? So do you all know the approximate principles, carbohydrates, proteins, fats, what are they? Are you aware of it or just not aware? Have some idea. Okay, so rather than me talking about, I need to keep this as an interactive session, otherwise 2 hour session is going to be really boring for me and for you all too. Okay, so I want what is diabetes from your side? It's just a flow chart. Can anybody just speak out what is diabetes? Can you just speak, ma'am? Any idea? Yes, yes. Can you just define diabetes in short?
It's actually the deficiency in the insulin level.
Yes.
When it goes down. So that's because of the sugar level that basically then increase that.
Okay.
That's why
Either the action of the insulin, okay, or the deficiency of insulin causing hyperglycemia, okay, which in turn not always hyperglycemia is diabetes, but yes, we have certain criteria which fulfill that if the person to be diagnosed as diabetes. And if the diabetes, the hyperglycemia state continues for a long time, the person will suffer from various metabolic disorders such as renal involvement, retinopathies, neuropathies, etc. Okay, criteria for diagnosis of diabetes. Which is the most important criteria for diagnosis of diabetes? Anybody? There are 2-3 listed out here, but which is the most important one? Can you speak? Which is the most important one among these?
Polyuria.
Criteria?
Polyuria.
Those are the symptoms. Yeah, I'm talking about the criteria, diagnostic criteria, which is the most important one among these 3.
The sugar level going, fasting, and post.
Yes, fasting is the most important criteria for the diagnosis of diabetes. Okay, a person can have postprandial or random blood sugars high at any time. It might be post surgery also. But a fasting blood sugar, if it is high, the person is diagnosed as diabetes. Okay, now which is the other test which is not mentioned here purposely?
glucose tolerance.
That is there towards plasma glucose. Which is the other one? Yes. Glycogen, yes, HbA1c. What is the normal? Do you all know about the latest ADA guidelines for HbA1c, which is below 8? That is somebody who is suffering from diabetes. But yes,
below 6.
Below 6. Yes, you're very much closer. It's 5.5 to 6 at present. If the person is having anything within this range of HbA1c, the person has to start taking preventive measures for diabetes. Okay, so just talking about this in short, because we have a lot to talk about diet. Okay, so one is fasting plasma glucose, which is less than 126 milligrams per dl. Then we have the random blood sugar, which is checking the blood sugars at any time of the day, which is greater than 200 if the blood sugars comes out to be greater than 200. And then we have the 2 hours post, that is PP that we're talking about, okay, postprandial, which again if it is greater than 200, the person is diagnosed as diabetic. Okay, so classification of diabetes mellitus, there is a whole list of classification. I've just mentioned a few of them and the important ones that we're talking about today. Okay, type 1, what is type 1, sir? Yes.
Insulin is not very
Yes, and it is found in what age group? Yes, juvenile diabetes. Is it just juvenile always? What is the age that we consider for juvenile diabetes? That is just juvenile. So, but is it not just seen in adults? What is the age limit for a person to be diagnosed as a type 1 diabetic and not type 2? What is the age bar? 20? It's anything less than 30. Okay? Although type 1 existence is always in the children, mostly, okay, genetically, but it is also seen in less than 30 years of age. Okay? Type 2 diabetes, we all know, it is caused due to various factors such as heredity, also one is the reason. Apart from which, distorted lifestyle, okay, age, insulin resistance, Okay, what is insulin resistance? Can anybody just mention? What is it?
It's insulin is secreted properly by the adipose Langerhans, but the cells are not sensitive enough to receive the insulin act.
Great. Good definition. Okay, so that's what is type 2 DM. Okay, and basically those criteria also are required for the detection of type 2 diabetes. Then we have gestational diabetes. What is gestational diabetes? Is it like, say, if a lady is pregnant, okay, and pre-pregnancy also she was a diabetic, would you still rate her into this whole lot? You all will be giving me the various causes of diabetes. In general, type 2, not type 1. So, hereditary. Great. I hope you are not going on the sequence which I have mentioned. Yes, I'm not mistaken.
Lifestyle disorder.
So what does lifestyle mean to you?
Diet and sedentary habits, faulty diets.
Great. Yes.
Stress.
Okay.
Pancreatic disorder.
Okay. Anything else apart from that?
Being overweight.
Pancreatic disorder and all these come into hereditary, genetic, everything. Apart from that, yes.
Being overweight will be higher
Yes,
fat
yes,
percent.
yes. One more.
Lack of exercise.
Yes. Yeah. Infection, hypertension, lipoproteins, lipids, hyperlipidemia also causes diabetes. Most of it is covered by all. Okay, so the basic treatment plan for diabetes is firstly definitely a well-balanced diet, but we're not killing the patient by giving him starvation diet. So you are into hyperglycemia, you have to curb carbohydrates. True, but then the trend of like, see, what's happening nowadays, the people don't understand the difference between a weight loss diet and a diabetic diet. जो एक रोटी पूरे दिन का concept है ना आजकल, that also the diabetics are following nowadays. So what happens is they go into hypoglycemia very easily. Okay, so we have to, with this session today, I'm stressing on that, how to prevent hypoglycemia also. Okay, so balanced and well-done diet, that's the most important. Okay, increase physical activity. Sedentary lifestyle, as you said, is one of the factors. De-stressing yourself, drugs, okay, OHAs and the other bioethanol, and insulin injections. These are the treatment plans for diabetes. This is a protocol, okay, mentioned in a Diabetes Care 2009 journal, which says these are the steps in how to treat a diabetic patient. Okay, we are not going to stress much on the step 2 and step 3 because that's the job of doctors. The first step itself involves lifestyle changes, that is diet and exercise. So when a patient comes to you, you will be starting the patient on the drug, but at the same time you will be advising the diet on the first session only. You will be not waiting for the sugars to get controlled with the drug and then following the diet. That's the cost of the drugs. Insulin injections, the drugs. Okay. So many patients come over, type 2 also, who are on insulin. They're like, madam, कैसे भी करके आप डाइट ऐसा दे दो कि इंसुलिन बंद हो जाए, because the cost is so high. Each pen costing $900, and if the units are too high, 20, 30, the pen gets over within a couple of days itself. Okay, so you'll have to really target diet and lifestyle changes. Okay, so first, in short, we talk about physical activity. Okay, when a diabetic comes to you, you have to always look at the weight first. Okay, सीधा जाके weight loss करने को नहीं बोलना है. Okay, so you have to make sure if the person is obese or overweight. How will you find out whether the person is overweight, or what is the baseline that you will be using? Body mass index. Okay, so fat percentage. Okay, but when we are talking about overweight, yeah, fat percentage comes as a ratio. Yes. Yes. Great. BMI is one factor which says that okay, the person is overweight. What is the other factor? How will you calculate? How will you come to know? BMI, okay, you come to know that BMI is 26. Now the person has to come down to 25. So उसके बीच में कितना weight loss करना है? How will you come to know? What is the baseline that you will use to determine okay, this should be the weight for the height? Yes. As per the height. Okay. Yes, height to weight ratio is BMI. But if the person is 150 centimeters, a lady is 150 centimeters, then we are going to target the weight as 45 kgs. That is 150 centimeters minus 105 is the glucose index. So as per that, we come to know what is the ideal body weight. Okay. Now, if this lady is say around 80 kgs, would you all target still 45 kgs? Just target 10% weight loss. It will help her in terms of her diabetes and lipid profile also. Okay, so you have to understand that just meeting up the ideal body weight is not important. Now, if this lady just needed a weight maintenance, the physical activity that you're going to advise is just 30 minutes of workout every day, most probably 5 days a week, okay, which can be split into 10 minutes of each. Because there are many women who are like say menopausal and then they come up with these problems of diabetes and they say, ma'am, we cannot exercise at a stretch for 30 minutes. Then you can just advise a 10-minute session. And for weight reduction, definitely 60 minutes per day of any kind of workout. Specifically here we are talking about only walking or something. Basically that a patient cannot go to a gym, has to do it by himself. Okay. So how will you monitor physical activity? I've got a pedometer with myself. Okay, this is the pedometer.